provide privacy and maintain dignity for the patient at all times. I'll also speak in terms that they can understand. When I first go into the patient's room, I'll get a birth history, either from the previous nurse or from the patient. I'll also obtain vital signs, which would be blood pressure, temperature, pulse, heart rate, O2. Then I would go into the acronym BUBBLE-HER. It stands for breast, uterus, bowels, bladder, lochia, and episiotomy, perineum. HER is home and sign, which we don't really do. E is emotional status, and R is ROGAM. So for B, for breast, I would ask the mom if she's breastfeeding or bottle feeding. If she's breastfeeding, it's okay if I stimulate the breast and palpate the breast. If she's bottle feeding, it's important to just observe the status of the breast and how they're doing. So for a breastfeeding mom, I would palpate around the areolas and see if there's any mastitis. There shouldn't be any because she's still in the hospital. Usually that happens 2 to 3 days after. I would assess the nipples, make sure there's no cracks, no lesions, no ulcers. After that, for a bottle feeding mom, I would just observe, I would just look, I would not touch or palpate to stimulate the breast. I also provide education that it's important that if she's bottle feeding to keep a tight bra on, and if she's in the shower, not to let the water run on her breast too long because that could stimulate milk production as well. For you, it's the uterus, and that's just palpating the fundus, seeing if it's firm or boggy. What I'll do is I'll put one hand down here by the pubic bone, and it's to keep the uterus from coming out and prolapsing. I'll take this other hand and I would massage down and press to see how the fundus is feeling. If the fundus is shifted over to the right, it's probably not firm, and it's also because her bladder is full. I would just ask if she would relieve herself and then come back and reassess that. For B, it's bladder. So I would ask, have you been able to void?
Yes.
Have you had any difficulty?
No.
Okay, perfect. For bowels, I would ask the same thing. Have you been able to have a bowel movement?
Yes.
Perfect. For the next letter in the acronym, it's L for lochia, and that is just discharge. There's 3 phases of it. It's lochia rubra, lochia serosa, and lochia alba. Each of them are a little bit different. The first stage is where it's going to be the heaviest flow of blood. It's going to have like an earthy, fresh, like fleshy smell to it, and you can also have some small clots. The second one, lochia serosa, should be lighter bleeding, could be a pink-brown discharge. And then the third one, lochia alba, it should be a white cream discharge. It's important to make sure that you educate her on the importance of saturating a perineal pad too quickly. It's usually within an hour or even 15 minutes. That could be a sign of any issues. So the next part would be assessing E, which is episiotomy, which we would say lacerations. We would check the perineum. I would open up her legs. And I would check the perineum, make sure there's no tears. If there is an episiotomy, I would just make sure there's no redness, edema, drainage. I would look at the approximation. I would also make sure that the perineum is intact. Next part of the acronym is the H, which is Hellman sign. We don't really do that, but we do check for blood clots. So what I would be doing is I would be looking at both legs, seeing if there's any noticeable change. I would ask, do you have any pain in your legs?
No.
I would feel for any heat, tenderness, and you can always measure the legs to see if there's any changes in size. A preventative measure is putting an SED machine on both legs after delivery, to prevent blood clots. The next letter of the acronym is emotional status. You want to see if the mom is taking hold. Is she depressed? Is she having any baby postpartum blues or postpartum depression, but postpartum depression, it isn't until later on in postpartum. So sometimes hospitals will provide a postpartum depression survey just to see how the mom is doing after delivery. The last letter of the acronym is R, and that's for ROGAM. That is to prevent the mom from forming any antibodies for the next or future pregnancies that she has. And after